$8 an hour or $62,000 a year. Let that sink in for a second. We're talking about the exact same administrative work, but with a wildly different bill at the end of the day. Welcome to This Explainer. Today, we're diving deep into the 2026 landscape of the dental virtual assistant. We're going to look at what they actually do, stack up human versus AI models, and break down the real bottom-line cost differences for your practice.
You know, so many dental practices realize they desperately need front office support. But here's the trap that so many fall into. They rarely calculate the true, fully loaded costs of how they're currently operating. If you just look at the hourly wage for an in-house hire, you're totally missing the hidden costs. I'm talking about the cost of missed calls, benefits, payroll taxes, the endless cycle of training and turnover. So we're basically comparing an $8 an hour remote model against a heavily loaded $62,000 a year traditional staffing model. And to really understand why that massive gap exists, we have to look at the day-to-day operational realities of a modern dental office.
Here's our roadmap for today. We'll quickly cover the front office squeeze, what a dental VA actually is, human versus AI models, the true cost breakdown, what you should delegate first, and finally, compliance and patient trust.
Let's start right off with part one, the front office squeeze.
Here is a pretty harsh reality for most dental practices right now. You probably don't have a people problem. What you have is a severe coverage and consistency problem. Just imagine your front desk team trying to give a warm, welcoming experience to a nervous patient who's standing right in front of them, but at the exact same time, the phone is just ringing off the hook. So what happens? Calls get missed. And a missed call? Well, that's a missed appointment that probably just booked with the dentist right down the street. Because your team is stretched so incredibly thin, things like insurance verification get rushed, which leads to surprise bills and really angry patients later on. Plus, those crucial recall lists just sit there untouched. The end result of all this is total burnout and massive, super expensive staff turnover.
That brings us to part two. What exactly is a dental VA?
Basically, a dental virtual assistant is a remote professional or an AI system that exclusively handles non-clinical front and back office administrative work. And we need to be crystal clear on this point right out of the gate. A virtual assistant is not a clinical replacement. They aren't taking x-rays, and they're obviously not managing your physical waiting room. What they are is strict laser-focused support for your admin layer. They exist to allow your in-office team to actually focus on the patients who are physically sitting in your practice.
A VA can literally take a massive amount of that back office heavy lifting right off your plate. We're talking about answering and routing patient calls, managing scheduling, firing off appointment reminders, and handling incredibly vital but tedious tasks like insurance verification. When your overwhelmed in-house staff tries to juggle ringing phones and insurance portals, verification slips, right? And that leads directly to denied claims. A VA handles all of that seamlessly alongside recall campaigns, treatment follow-ups, and intake support. It's a total game changer for your workload.
Moving on to part three, human versus AI models.
Let's start by looking at where a human virtual assistant absolutely shines. Human VAs are incredible when your practice needs genuine, relationship-based support during working hours. Think about it. If a really anxious patient calls in and needs their hand held through a complex procedure explanation, a human VA has the empathy to actually build that trust. They're also unmatched when it comes to managing messy insurance exceptions, navigating complicated multi-stage treatment plan follow-ups, and coordinating directly with your in-office clinical team. Basically, they bring real human judgment and nuance to the table.
But then we have to contrast that with AI virtual assistants. And AI systems are just absolute powerhouses when it comes to speed, consistency, and relentless availability. They answer calls 24 hours a day, 7 days a week. That includes weekends, late evenings, and right in the middle of your staff's lunch break, without fail. They offer instant missed call recovery. They flawlessly handle routine bookings and reminders by plugging right into your practice management software, and they can scale high-volume recall text campaigns instantly. They don't take breaks, they don't get sick, and they quite literally never have a bad day.
So when you actually stack them side by side, it's pretty clear. You have the human VA bringing empathy and judgment, but limited by typical working hours and human bandwidth. On the flip side, you have the AI assistant, completely built for repetitive tasks, high volume, and always-on availability. The big takeaway here? The question you should be asking isn't, should I use a human or an AI? The much better, far more profitable question is, what tasks should my human team handle, and what tasks should I just let an AI automate?
Which brings us perfectly to part 4, the true cost breakdown.
Let's dive into the actual math here and look at the direct monthly financial gap. An AI virtual assistant generally runs anywhere between $199 to around $870 a month. And remember, that gives you 24/7 coverage. Now, a human virtual assistant, typically an offshore professional working your standard business hours, usually costs around $1,200 to $2,500 a month. But watch what happens when you compare both of those to a traditional in-house front desk hire. That runs roughly $3,800 to $5,800 a month and is strictly limited to your physical office hours.
And that brings us right back to this staggering number, $62,000. That is the estimated annual cost of a single full-time front desk employee in the U.S. And that's once you factor in wages, payroll taxes, health benefits, the time it takes to train them, and the inevitable turnover. When you compare that $62,000 to the cost of an AI or human VA, you aren't just saving a few pennies here and there. You are fundamentally restructuring the entire overhead of your practice.
So, part 5, what to delegate first. How do we actually put this into practice?
Well, let's start with what you should immediately hand off to an AI assistant. You really want to delegate those high-volume, repetitive tasks to maximize your efficiency. For example, set up your AI for missed call text backs. That way, if the phone rings while your staff is busy with a patient, the caller instantly gets a text to book online. Give the AI your appointment and recall reminders, basic scheduling duties, routine FAQ answering, and absolutely all of your after-hours call handling. Doing this creates an immediate safety net to catch all that revenue that is currently just falling right through the cracks.
Next, let's look at what you absolutely should reserve for a human VA. You want to give them the tasks that require deep judgment, patience, and finesse. This includes chasing down messy insurance verification exceptions, having those complex billing conversations with confused patients, executing high-value treatment plan follow-ups where you really need a persuasive human touch, and handling any escalations or relationship-heavy admin work.
Then, of course, we have the overlap. Things like scheduling workflows, driving recall campaigns, treatment follow-ups, managing review requests, and overflow call handling. These are actually best tackled by a hybrid approach. For a lot of high-performing practices in 2026, combining an AI assistant for that initial frontline speed and then using a human VA for the complex follow-through, well, it creates the ultimate safety net. It guarantees absolute consistency while still maintaining a really high quality of patient care.
Finally, we reach part 6, compliance and patient trust.
This is the elephant in the room, right? The critical question we have to ask head-on: are dental virtual assistants actually HIPAA compliant? Because before you even think about handing over your scheduling software or patient data to a remote worker in another country or some cloud-based AI, you need to be absolutely 100% certain your patient's privacy is protected.
The good news? The answer is yes, they absolutely can be compliant. But, and this is a big but, it is not automatic. It requires you to verify specific, non-negotiable safeguards. Whether you're using a flashy new AI platform or a human VA agency, you must have a signed Business Associate Agreement, or BAA, in place. You have to verify they use encrypted communication channels, they need strict access controls limiting exactly who can see patient data, and if you're using human VAs, you need proof of documented, up-to-date HIPAA training. Honestly, if a vendor can't provide these things right away, walk away immediately. It's just not worth the risk.
So to wrap this all up, the cheapest option is never the best option if your patients are still falling through the cracks. When you evaluate your staffing needs and you look at that $8 an hour versus $62,000 a year, please don't just look for the lowest monthly fee. You have to evaluate these virtual models based on actual recovered revenue, the missed calls they caught, the lapsed patients they brought back in, and the denied claims they prevented. When you match the right technology and the right remote talent to the right tasks, your practice just fundamentally operates better. So, the only question left to ask yourself today is this: what is your practice's current coverage gap really costing you?